I'm going to be talking about autism spectrum disorder, or ASD. Autism is defined as a mental disorder that is marked by impaired ability to communicate and form social relationships, and by repetitive behavior patterns. Talking definitively about autism is a bit daunting, in that the definitions and beliefs about autism seem to be rapidly changing as we learn more about the condition. No two people with autism are alike or share all of the same symptoms. Autism has many faces. From Temple Grandin, who's been successful using her specialized interests to make great contributions in the cattle industry and had a movie made about her starring Claire Danes, to Susan Boyle and Daryl Hannah and many other successful individuals, from actors to scientists, scholars and writers, and no doubt each of you knows someone or has a family member that falls somewhere on the spectrum. This is my daughter Alex, who I've talked about in the discussions in the class. She calls herself an Aspie, and she has been diagnosed with Asperger's syndrome. Some speculate that Isaac Newton, who had the ability to lock himself away for years at a time and focus his attention completely on his interests, is an example of someone with Asperger's. His symptoms certainly seem consistent, as he lived reclusively, even fixating on religious imagery and ideas that were quite out of the ordinary, even destructive, while simultaneously making some of the most significant discoveries in the scientific world. When autism was first identified, clinicians believed it was an emotional disorder, caused by the cold, rejecting parenting style of so-called refrigerator mothers. Today, psychologists know that autism is a problem in the way the brain works, not in how people are raised. That discovery has led them to develop medical, educational, and behavioral approaches to treatment. The manifestations of autism cover a wide spectrum, ranging from individuals with severe impairments, who may be silent, developmentally disabled, and locked into hand flapping and rocking, to high-functioning individuals who may have active but distinctly odd social approaches, narrowly focused interests, and awkward, pedantic communication styles. Because the behavior spectrum is continuous, boundaries between diagnostic categories are necessarily somewhat arbitrary. Sometimes the syndrome is divided into low, medium, or high-functioning autism based on IQ thresholds, or on how much support the individual requires in daily life. These subdivisions are not standardized and are controversial. As we discussed when we studied the Men from the Wreckers and Jabberers documentary, your ability to cognitively process information and the ability to verbally communicate it is often very out of sync. Likewise, the ability to perform daily tasks for a person with autism can often have very little to do with their intelligence level. Someone may possess the ability to write a beautiful poem or solve a difficult mathematical equation, but struggle with the steps required to get ready for work in the morning. There are 4 main subtypes of autism: autistic disorder, also known as autism, childhood autism, early infantile autism, Kanner's syndrome, or infantile psychosis. This is the classic autism we often hear spoken of. Asperger's syndrome, also known as Asperger's disorder, or simply Asperger's. This is often referred to as a higher functioning autism, and is often differentiated by the lack of significant delays in speech or motor development that you'll see with classic autistic disorder. Childhood disintegrative disorder, also known as CDD, dementia infantilis, disintegrative psychosis, or Heller's syndrome. CDD is marked by a normal level of development followed by a loss of skills, which can include speech, social skills, motor skills, and even bladder or bowel control. Pervasive developmental disorder, not otherwise specified, also known as PDD-NOS, or atypical autism. It's a bit of a catch-all diagnosis for someone who has many of the symptoms of autism but doesn't fit into the normal criteria for the disorder. Rett syndrome is no longer considered to be a subtype of autism, although individuals with Rett syndrome may display autistic-like symptoms. It is a rare neurological disorder and is more prevalent in females, often presenting with seizures and gastrointestinal disorders, short stature, and a lack of verbal skills. In the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, which was published in May of 2013, these 4 subtypes were eliminated and dissolved into one diagnosis called autism spectrum disorder. According to the American Psychiatric Association, this represents an effort to more accurately diagnose all individuals showing signs of autism. Autism isn't usually diagnosed until after age 2, when delays in a child's social behavior and language skills become apparent. The average age of diagnosis and early intervention remains stubbornly above 4 years old in the United States. Studies show that children exhibit clear signs of autism at a much younger age, however, with indicators present even in infancy, and reliably by as young as 24 months. The sooner we're able to identify early markers for autism, the more effective our treatment interventions can be. Many are not diagnosed until much later, especially for the higher functioning types. Studies show this later intervention is not nearly as effective, and some scientists are advocating that regular screening for every child become routine. So, early signs of autism can include slow speech or slow motor development, fixation with objects rather than people, not making eye contact, not smiling, not pointing at objects, a lack of interaction, not cooing or babbling, not showing affection or not wanting to cuddle unless they decide to themselves, not reacting or showing a reaction to loud noises, and sort of a blank, non-reactive stare. Symptoms in teens and adults can look like trouble empathizing with others. Although they do have empathy for others and are often quite sensitive, they lack the ability to have that theory of mind or to automatically get inside somebody's head and imagine what they're thinking. Difficulty interpreting social cues, trouble forming and maintaining relationships, difficulty making conversations, trouble understanding socially appropriate behaviors, trouble understanding double meanings, anxiety in group settings, a tendency to interpret information very literally, a difficulty making eye contact, and what we've talked about before, restricted or very unique interests like memorizing facts or fixating on numbers or patterns or really anything specifically that is interesting to them. They tend to fixate on those things almost in an OCD kind of way. And trouble making plans for the future or those higher executive functioning skills. As of 2014, approximately 1 in 68 children in the United States has an autism spectrum disorder. Numbers have been steadily growing, but much of that could be due to better and earlier diagnosing, and even to factors like older ages of parents giving birth. ASDs continue to be almost 5 times more common among boys, 1 in 48 for boys, and then they are among girls, which is 1 in 189. The causes of autism are still being investigated. Many experts believe that the pattern of behavior from which autism is diagnosed may not result from just one single cause. There's strong evidence to suggest that autism can be caused by a variety of physical factors, all of which affect brain development. It's not due to emotional deprivation or the way a person has been brought up. It's generally accepted that it is caused by abnormalities in brain structure or function. Brain scans show differences in the shape and structure of the brain in autistic versus non-autistic children. Researchers are investigating a number of theories, including the link between heredity, genetics, and medical problems. In many families, there appears to be a pattern of autism or related disabilities, further supporting a genetic basis for the disorder. While no one gene has been identified as causing autism, researchers are searching for irregular segments of genetic code that autistic children may have inherited. It also appears that some children are born with a susceptibility to autism, but researchers have not yet identified a single trigger that causes autism to develop. Some parent groups have advocated for a link between immunizations and autism to be recognized, but many scientific studies have been done and determined that they can rule out immunizations as a cause. Other studies have shown other connections. One study published in a Scientific America article found that gut bacteria may play a role in autism, citing evidence that intestinal microbes exacerbate or perhaps even cause some of autism symptoms. Gastrointestinal issues are known to have a high correlation or comorbidity with autism spectrum disorders. Other related or comorbid conditions are anxiety disorders, OCD, epilepsy, sleep disturbances, autoimmune disorders, ADHD, bipolar disorder, Tourette's, clinical depression, tuberous sclerosis, and visual problems. Speech therapy has been one of the primary focuses of treatment for autism. Most autism treatment plans for young children focus on social communication because the disability has such a significant effect in that area. Research has shown that successful social communication interventions can improve IQ, language, play skills, and more for children with autism. One-on-one therapy and teaching can be beneficial for some. Learning that doesn't overload their senses, where they can interact and not phase out as they may in a group setting. Social skills training can help children with autism improve their interpersonal functioning. In a classroom, for instance, peers without autism can help those who have the disorder by teaching and modeling appropriate social behavior. My daughter has done much better with regular socialization, especially because the tendency to withdraw can cause its own symptoms of depression, losing social skills that she once had, going into your own world, so to speak, and can lead to fantastical type thinking that further isolates you from people. Research has shown that successful social communication interventions can improve IQ, language, play skills, and more. Many new apps are being designed to help those with autism improve their social skills. One that I looked up called Face Say helps kids to recognize emotions displayed in facial expressions. It causes them to zero in on the upper half of a person's face to follow cues. Digital communication aids, like we witnessed in the documentary, that allow written communication when speaking is difficult for them, can obviously be a life-changing thing for some. And internet communication has given those with autism a whole new way to connect to the world. For my daughter, who has a lot of trouble with conversations that are face-to-face, she's found a whole new voice in being able to type out her thoughts and connect to people without the delays and the awkwardness that accompanies her regular interactions with people. Motor skills therapy is also important. In a new study that looked at toddlers and preschoolers with autism, researchers found that children with better motor skills were more adept at socializing and communicating. So incorporating fine and gross motor skill development into early interventions can provide a similar boost to what has been seen with speech therapy. Medication can help some with autism, although no drug specifically targets the disorder. Instead, clinicians use medication to help manage symptoms like seizures or hyperactivity or anxiety. Many treatment programs emphasize operant conditioning, which we've learned about, which uses rewards to encourage good behavior and punishments to discourage bad behavior. This approach can help improve communication and social interaction and decrease troublesome behaviors like aggression or self-injury. A similar approach is cognitive behavioral therapy, which targets thoughts as well as behaviors. Physical therapy is also sometimes indicated, as in my daughter's case, because low muscle tone and a lack of mobility can also be an issue for some. As more funding is becoming available, a lot of new exciting research is being done that could lead to future treatments. A study has linked a gene to the disorder. Another has identified a DNA chain that is involved. The use of brain scans to see the areas of hyperactivity that are similar to those seen in epilepsy could lead to the use of similar drugs as treatment. Other studies help us identify risk factors, like older parents giving birth and similar traits in parents and siblings, even connections between trauma in the mother or specific bacterial infections in the mother during pregnancy. One expert stated that the majority of research on autism has focused on early childhood, but autism is a lifelong disorder with impairments that limit quality of life throughout adulthood. She went on to describe how differently autistics process information, and that we often see this as a dysfunction. But considering the prevalence of the disorder, we need to put more effort into finding ways to fairly assess and utilize these strong abilities that she believes are now undervalued. So the goal really is to teach them skills and coping mechanisms to allow them to be as independent as possible, using whatever treatment is available. To use those special interests to fuel their learning and success and keep them involved in the world around them, while still respecting their need for space and solitude, so they can use their specialized skills and be productive. I appreciate you listening. There was no way I could possibly fit all my research into this demonstration, so I welcome any questions you might have. Thank you.